So just some general facts about cystinuria. You guys know, many of you, their stones are often large. They come back. They cause a lot of pain. And what I've learned, if you look at the textbooks about the disease and about kidney stones, the textbooks teach urologists that you only get pain when there's a stone blocking the tube between the kidney and the bladder or blocking some piece of the kidney. But what I've learned after a lot of years of doing this is that that's not always the case, that a lot of patients have pain for a lot of other reasons, and it's probably because you've had chronic pain for so many years, so many stones obstructing that your nerves are now very super sensitive. Now, I can't tell you that that's exactly the reason. There's no studies that show that, but we do understand that pain is not just when you're having an episode. It's also can be other times, and there are other things that you can do for that type of pain. In terms of cystinuria, though, you know that you might have back pain or blood in your urine. Surgeries may very well be necessary, and we'll get to that. And if you have enough surgeries, it can potentially lead to damage. So we've talked about all of this here. It's just taking more questions. Question about transplant. Would a cystinuria patient ever be eligible for a transplant? Ultimately, the goal is to not get to that point. Many cystinuria patients do have elements of chronic kidney disease. They've lost some of their kidney's ability to do the job that they're intended to do. A very small percentage of patients do end up having dialysis and requiring a transplant. If you get to that place, and again, we want to try to prevent you, and that's part of this talk is to teach you about different techniques to prevent stones from forming. If you get to the point where your kidneys have failed you and you do get a transplant, you are cured from cystinuria, because unless you happen to get a kidney from a cystinouric, which I would imagine shouldn't happen. I've never heard of it happening, but possible, I suppose. But if you get a kidney that's not from a cystinuria patient, you will be cured of cystinuria. But then you have a transplant, which is got its own sets of problems, having medications that prevent your body from rejecting the organ, can also cause you to get infections and other problems. And you have to be on those medications for life. So the goal would be to prevent you from ever getting to the place where you would need a transplant.